We're now live, you can proceed.
Thanks so much for joining us today. Before we get started with our briefing, I'd like to hand it over to Gilbert Martinez from our communications team for a message for our Spanish-speaking viewers.
Buenas tardes y bienvenidos a la sesión informativa organizada por la supervisora Hopkins y la doctora Mase. Esta sesión informativa se está transmitiendo en vivo por nuestro canal de YouTube con interpretaciones al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias. Ahora regresamos para atrás con supervisora Hopkins.
Thank you so much, Gilbert, for that assistance. I really appreciate it. Good afternoon. I'm Supervisor Linda Hopkins, Chair of the Sonoma County Board of Supervisors, and this is our COVID and vaccination update for Friday, February 19th. I'm happy to report today that thanks to a multi-agency effort over the past 2 months, Sonoma County has now administered more than 100,000 vaccines to county residents. As of this morning's figures, we have administered 7,807 vaccines, that's a mouthful in total, which is pretty equally divided between Moderna and Pfizer vaccines. Now, when you break this number, this mouthful of a number, down on an individual basis, it actually means that more than 1 in every 5 residents over the age of 16 has now received at least 1 dose here in Sonoma County. I want to acknowledge that despite that number, we do still have a long way to go. However, this is an important milestone that's really a testament to all the hard work by our county health team in activating more than 20 clinics throughout Sonoma County over the past 8 weeks. We are also very, very thankful for the efforts of our healthcare providers. Tens of thousands of local vaccinations have been provided by Kaiser Permanente, Sutter Health, and St. Joseph Health of Northern California. I also want to report that we have made some great progress in getting vaccinations for our most vulnerable residents, those ages 75 and above who unfortunately were suffering with very high fatality rates from this disease. At this point, though, we have been able to provide at least 1 dose to 62% of our residents age 75 and over. We also have been able to vaccinate 46% of those between the ages of 70 and 74. This again has been the result of tremendous efforts by many people and healthcare providers, including our federally qualified health clinics, those community health centers, to get appointments for our eldest and most vulnerable residents, many of whom would not have been able to book appointments, let alone get to the clinics on their own. So I just want to take a moment to thank everyone in the community who has taken part in this amazing gargantuan effort to help these residents. So this brings me to our big announcement of today. I'm very pleased to report that because of our progress, we are at a place now where we can open up our vaccinations to those aged 65 and over, starting on Monday, February 22nd. For more on this information, I'd like to turn it over to Supervisor Chris Coursey.
Thanks, Supervisor Hopkins, and that is good news. I think it's important, though, that we take a minute to remember how we got to this point. As many of you know, the governor announced in early January that those 65 and older were eligible to be vaccinated, but he left the option open for counties like ours to focus on those older than 65 if we so choose. Overall, we have about 102,000 residents in Sonoma County aged 65 and older. And the county receives only about 7,000 or 8,000 doses of vaccine a week. Opening the door to all 100,000 plus older residents was just going to be overwhelming. It would not have worked. It didn't make sense. So during the first part of our rollout, we focused on getting vaccines to those 75 and older, who represent 2/3 of those who have died in our community since this pandemic began. Then about 2 weeks ago, we lowered that benchmark to 70 and older. And now, starting on Monday, we'll be opening up to the rest of those in phase 1B, tier 1. That includes people 65 and older, along with essential grocery and restaurant workers. We want to be clear, though, that while we open this up to that larger group, the availability of appointments is still going to be limited by the supply of vaccines that we receive. Our supply is meager compared to the demand that we face. So just because you're eligible doesn't mean that you'll be able to get an appointment right away. You're likely to face challenges in getting an appointment. So please understand and be patient. We also ask that if you're able to safely shelter at home for a while longer, don't rush to get an appointment. We have many people with severe health issues or jobs such as grocery clerks and restaurant workers that place them at risk, much greater risk than somebody who's able to stay at home. So please, let's let them go first. I'm going to turn this over now to Dr. Sundari Mase, our health officer, who's going to give us an update on the pandemic.
Great, thank you so much, Supervisor Coursey and Chairwoman Hopkins and everyone else that's attending today. I want to speak a little bit about our COVID metrics. All of our metrics are still looking good this week. Our case rate continues to decline, although we're not seeing the steep drop in cases that we saw post-holidays. Our adjusted case rate has leveled out around 14 new cases per day per 100,000 residents. That's still double the 7 new cases per 100,000 per day that we need to move into the less restrictive red tier in the state's blueprint for a safer economy. Our testing positivity, however, is looking even better. We are at 3.8% overall testing positivity, which puts us in the orange tier, 2 tiers below our current purple status. Our testing positivity in the lowest quartile of the Healthy Places Index is down to 5.4%, which is still in the red tier. But if that number comes down just a little bit more by 0.2% to 5.2%, that then puts us in the orange tier in both testing positivity metrics the state uses to determine tier status. If the numbers stay that way for 2 consecutive weeks, then we could end up moving into the less restrictive red tier and be able to open up new parts of our economy for the first time since August. So that is exciting. But even if we see this improvement in case numbers, I still want to remind residents of our county that there are many, many COVID testing opportunities that you should use if you suspect that you've been exposed, or if for any reason you feel ill, you just want to make sure that your test result is negative. Knowing your status helps you protect yourself, your family, the community, reduces transmission, and moves Sonoma County closer to getting people back to work and school. People with COVID may not experience symptoms. In fact, we know that up to 30–40% of persons with COVID may have no or mild symptoms so that they don't know that they're sick. Testing ensures that you don't pass COVID on to friends, family, and coworkers, which you can do even if you're asymptomatic or have extremely mild symptoms. You can get tested at sites throughout Sonoma County 7 days a week. To find a testing event near you and to schedule an appointment, visit the testing page at socoemergency.org. Also, ensure that you're still following all the mitigation measures. As we begin to vaccinate more and more people in the county, which is fantastic, we still have to remember that hand washing, the use of facial coverings or masks, and social distancing are really important tools, in addition to testing, as we just talked about. So now I'm going to turn this over to Dr. Shende, our vaccine chief.
Thank you, Dr. Mase. As Supervisor Coursey has mentioned, we've been making great progress in our vaccination efforts. As of today, a total of 85,889 residents in Sonoma County have been given at least 1 dose. About 21% of those who are eligible in our county have now received at least 1 dose. More than 5% have been fully vaccinated. We also continue to make steady progress. In fact, compared with other California counties closest in population size to ours, Sonoma County is still ahead of the curve in terms of vaccines administered on a per capita basis. We will be issuing a press release shortly that covers some of the topics at our briefing today. And in that, we include this chart that illustrates how we're doing in terms of getting the vaccines out. So as you can see from this chart, compared to counties that are bigger and smaller than us, we are doing quite well. We're at more than 20% of the population. And again, everybody is doing quite well, but comparatively, we're doing all right. Also, as Supervisor Hopkins mentioned, starting on Monday, we will be opening up vaccinations for those 65 and over. Priority will still be given to those with comorbidities. We'll also be opening up for essential food workers, including food manufacturing, grocery store, and restaurant workers, who will also be eligible for vaccines starting on Monday. And these changes in prioritization will bring Sonoma County in alignment with California Department of Public Health guidelines for COVID-19 vaccination distribution for those in phase 1B, tier 1 of the state vaccine distribution plan. You can find more information by going to the state website at covid19.ca.gov. We thank you all for your support and most of all your patience as we work through the challenges of vaccinating our entire population, not just once, but twice. We are making progress. It's slow, but it's steady. In the meantime, please continue to wear your mask. Please continue to practice social distancing, and please do get tested. You can go to socoemergency.org for more information. Thank you.